So, Yasmin, we are so excited to have you here at NOFAS.
Well, thank you, Kathy, and it is my pleasure, really. I enjoy just having that interaction with you. I've enjoyed it over the years, and so this is just a perfect way to continue that interaction. I am, an admirer of your work and people at NOFAS as well, and so I really believe in the cause of people with FASD. I think this is what we should be doing.
Yeah, and I can't wait to find out more about how you got involved with this, because as you know, we've known each other for a good while now and always shared great enthusiasm for the work that we do. Your title is the Clinic Director of the FASD Diagnostic Center at the University of Louisville. Can you tell me a little bit more about your role there and about the clinic?
Sure. So we started it, we worked with people in the state of Kentucky to look at what are the kinds of issues that we need to work on. One of the biggest issues was that there wasn't a diagnostic clinic. We are an interdisciplinary clinic, so we have a developmental behavioral pediatrician, and then we have psychologists. We also have occupational therapists, speech language pathologists, nutritionists. We have genetic counselors. We have actual clinical geneticists, MDs who specialize in genetics and metabolic. And so we have this rich group that we can talk to and really learn a lot from.
How does it work? If someone wants to refer someone in, what's the criteria and what might limit somebody from being able to enter the clinic for a diagnosis?
Generally, we accept individuals from the state of Kentucky who are from 0 to 18 years of age.
Oh, 0 to 18. So let me just ask you about that. Will you see someone who is over the age of 18? Never.
We've done it before. We've done it a few times. We do have people outside of that core clinic that we tap to do adult evaluation. So I will still be part of it, but there is a psychologist who is actually outside of the clinic but still within the Weisskopf Child Evaluation Center, whom we can tap to be the adult psychologist to do evaluations.
Well, that's great news, because that certainly is one of the real gaps in services, because many folks with an FASD, especially when it's more ARND, oftentimes don't really, a lot of their problems, maybe with executive functioning and judgment, really manifest after the age of 18 when they are entering a transitional period of trying to develop some independence. So, here at NOFAS, that's one of the big problems that we have, is getting someone to assess and hopefully diagnose a person with an FASD that's over the age of 18. So that's good news.
I think that really most pediatricians, most medical providers probably still think of the facial features as the main parameter by which they would diagnose somebody with fetal alcohol syndrome. Let alone think about the spectrum of fetal alcohol spectrum disorders. However, we are now trying to train more people through the CDC regional training centers, a whole host of people, medical providers, who now understand that FAS and FASD really go beyond the facial features and the growth deficits, and really go into how the brain can affect behavior, how the brain differences can affect learning, and so that the child with FASD may present with just those particular features of brain difference rather than the facial or growth deficits or parameters.
Well, that's exciting, and maybe we can talk about that for a moment, the regional training centers. So you are involved with the CDC's Centers for Disease Control regional training centers. Can you tell me a little bit about that and help me to understand exactly what that is and what your role is with the RTC?
Absolutely. Well, I am part of the Southeast Fetal Alcohol Spectrum Disorders Regional Training Center, which is one of 5 regional training centers funded by the Centers for Disease Control.
So it's really exciting to know that there is funding for training. So for instance, if you worked in a hospital, let's say, or taught a nursing school program in one of the states that you cover, could someone contact you and ask someone to come out and provide a training for them? How does that work?
Absolutely. They could just contact the CDC regional training center that serves their particular state, or if their state is not represented, we've had people coming from outside our specific regions and contact us and eventually be incorporated within our regional training center as at least a site that we can serve. Clearly, there is an opportunity for people to ask for help, to get some training into medical, nursing schools, or allied health professional type schools.
This is something I hear a lot of debate about, on who can make a diagnosis, and is it appropriate for a pediatrician or any other MD or PA or even nurse practitioner for that matter to diagnose an individual at least with the full fetal alcohol syndrome. When is it appropriate for a physician or a pediatrician for that matter to make a diagnosis of FAS when they know there was maternal alcohol exposure and someone meets the criteria for the full-blown FAS? Is that okay to do?
You know, I'll tell you that the problem right now is not in not making the diagnosis, or rather in people making too many diagnoses, but rather that people are not going out there and saying that there is an issue called fetal alcohol syndrome that could be affecting the child. Even if it's a suspected FASD, you know, if people can even just identify that there could be brain-based issues that affect how an individual performs in various facets of living, school, occupation, and things of that, community living, I really feel comfortable in individuals who are trained to recognize and diagnose this, to actually make the diagnosis. I don't have any problem with people doing that as long as they follow the criteria at least set forth by the National Center on Birth Defects and Disabilities, the CDC. It is a guide, and so there is still some clinical judgment that goes in that. There is room for people who diagnose FAS to still have an understanding that there could be other things going on with the individual, you know, neglect, abuse, things like genetic conditions. I think if they know their limitations, at least professionally, they can make the diagnosis, but recognize that there could be other things that go on in the individual.
Yeah.
Making the diagnosis, however, I think is really the first step. And if they wanted to refine that by going into which FASD, that would be great. I think the criteria for FAS as it was set forth in 2004 is really quite clear. And if you say, well, an individual has all three facial features, growth deficits, you know, below 10th percentile, at or below really, and then you have microcephaly or a small head size, and you know that this is a child who was not necessarily just deprived nutritionally and that's the cause of all that, then, you know, it is quite clear that this is a diagnosis of fetal alcohol syndrome, and especially, of course, if you have known exposure to alcohol in utero or prenatally.
So you believe that a diagnosis of FAS or an FASD would be helpful for the child or adult possibly and their family to have the correct diagnosis?
I really believe that, and then the reason is a lot of times people think that it is just gonna stigmatize the child or the family, but the real issue might be, what do we need to know and understand about the child? We have to start there. And when we have a diagnosis, then we are able to look into what kinds of things are common in this particular condition, what kinds of other issues should we look into knowing that there is prenatal alcohol exposure and the diagnosis of FAS, and what are the management strategies that have been seen by other families to be helpful to this kind of individual. And actually there are now some evidence-based interventions that are specific to fetal alcohol syndrome. There's an intervention to help children with math, you know, developed in Emory University. There is an intervention that helps with social skills, developed in California. And then there's also some interventions that are quite intensive and involve helping families through the difficulties of addressing the brain-based challenges of FASD in real life, you know, the behavior issues that crop up and that need support probably for an extended period of time.
So at your clinic, once you make the diagnosis, you don't just send the family out the door.
I do not believe that that is the right approach. I believe that if you make the diagnosis, there is a responsibility that is attached to that, and that is to know where to send the family for more help and to really be able to advocate for that child in all spheres of that child's life, be it in early intervention or the school system. And I keep talking about that because those are the main places I think that a child would need help. I mean, all the way through 18 or maybe 21 in some cases at least. But the other thing is also advocating for the child in the workplace, or the adult in the workplace, and then eventually maybe in the legal system, justice system, because some individuals with FASD unfortunately do have some issues in that particular arena because they weren't identified and therefore go with the wrong crowd, and really some may go to the criminal justice system because of lack of intervention early on.
Now, certainly in my situation, I think it's very clear when you raise a child with FAS, you want to prevent it from happening to any other family. But how did you get involved in this, and where does your passion for the issue come from?
Well, I'll tell you, Kathy, I started in 2006 to really just get interested in this, and that may not seem like a very long time, but I have a long history of looking at systems of care. Who is underserved right now in this country, in different countries, and what are the kinds of things that we could do to help them? One mother asked me, so what do you know about fetal alcohol syndrome? And I was, quite embarrassed that I didn't know that much. And so what I did was train myself. I believe when she was telling me, actually the mother was telling me, there is nobody in this state who is doing work with fetal alcohol spectrum disorders, not a clinician. And so I want to know, do you know much about it? So I actually started by reading about it, and then I encountered the CDC criteria, and then went to Diane Malbin's training in Oregon, Portland, Oregon. So thank you, Diane. She's really, she was quite inspirational in that 3 days that I was with her.
And it's interesting getting involved in this whole world of FASD. Once you hear about it, you think, oh, well, certainly, if we got this on the airwaves and we told everybody, then we would solve the problem. But the longer you're in it, the more you understand that, as you said before, it's one person at a time, one school at a time, one community at a time. It's really a grassroots effort. And that's how we're really going to make those behavioral changes that will eventually prevent future cases, hopefully, of FASD.
What I want to see next is where it comes from above as well. Where we could have it almost imposed upon us that we help these individuals and provide the services, and that the schools are mandated to provide services to an individual by virtue of the diagnosis of FAS or one of the FASDs, to be one of the 13 categories of disability, how people term it in the school system. That would be the goal, because we want people served when they have the diagnosis, because these are the individuals who are often falling through the cracks. We know this.
Yeah, and here's the thing. Here's how this works. And that's why NOFAS is so excited to have Kentucky now as a NOFAS affiliate. And I really, unbelievably, I don't think that will happen until we have the collaboration of folks that work in this field, that see this issue every day, that live this issue every day, gather and have a unified voice to make a difference. And that's really where we're trying to get to push that change.
Absolutely. FAS and FASD is a real issue. It's a public health issue, and it is something that we can all do something about and work on.